I felt devastated and hopeless. I felt like I didn't have a future. There is no use to continue with my studies. My family was not giving me any support at all. They could not accept the condition and still hope that someday I would be able to get pregnant. My uterus, they say it's missing. I feel incomplete as a woman. I feel less of a woman.
A sense of being incomplete as a woman. That is how a woman with MRKH syndrome would describe themselves. With a reported incidence between 1 out of 4,000 to 5,000 cases, Mayer-Rokitansky-Kuster-Hauser syndrome is reported as a rare congenital disorder. A woman with MRKH syndrome are born without the Mullerian duct. In other words, the oviduct, the uterus, the cervix, and the upper vagina of this woman are not developed. The inability to be pregnant has a huge impact on their mental health as well. Most of them will suffer from depression, low self-esteem, and feeling incomplete as a woman. Therefore, in this video, we aim to fix the society's negative view on MRKH patients and perhaps will provide a better life for them in the future.
Types and symptoms of MRKH.
MRKH composed of two main types, type 1 and type 2.
In type 1, only the uterus and upper two-thirds of the vagina are affected. Ovaries are typically present and function normally. They usually have normal external genitalia. In type 2, the uterus and upper two-thirds of the vagina may be absent. There are also additional abnormalities at kidney, skeletal, and heart defects. Their ovarian function can vary, depending on the individual.
While symptoms of MRKH syndrome can vary depending on the type and individual circumstance, but they commonly include absence of underdevelopment of the uterus and upper portion of the vagina, primary amenorrhea, normal development of secondary sexual characteristics such as breast development and pubic hair, normal external genitalia in most cases, psychologically and emotional challenge related to infertility, and issues with sexual identity and intimacy.
Today, the exact reason to MRKH syndrome is still unknown, but there's no doubt it is of a genetic origin. At first, MRKH syndrome is thought to occur randomly due to non-genetic or environmental factors such as exposure to a teratogen, which is an agent that can disrupt embryo development. But as of now, no link between the environmental cause and MRKH syndrome has ever been confirmed. In recent years, increasing evidence suggests that MRKH syndrome is a genetic disorder. Some researchers propose that in familiar cases, the disorder can be inherited as an autosomal dominant trait with incomplete penetrance and variable expressivity. This means that the MRKH syndrome is caused by an abnormal gene that can be inherited from either parent or can be the result of a new mutation gene in the affected individual. Researchers propose that polygenic multifactorial inheritance as a cause of MRKH syndrome. refers to the interaction of many genes in the development of a disorder. At the present, research is still ongoing to determine the exact underlying causes of MRKH syndrome, including identifying the gene or genes involved in the development of the disorder and determine whether environmental factors play a role.
There are several treatments if patients of MRKH wish to have their own biological children. First, MRKH dilation therapy. MRKH dilation therapy is often the first step of the treatment. It is a very low-risk treatment. People could try to lengthen their vagina by either using dilators or coital dilation. These treatments only take 6 months and almost 90% of people use this treatment. Other than that, those with MRKH could have their own biological children since MRKH syndrome does not affect their ovaries. Those with MRKH could get some reproductive help through in vitro fertilization or surrogacy. However, people with MRKH also need psychological support from their family, friends, and counselor in order to address their concerns regarding their condition. A Malaysian published author, wrote informed writer, and also an active MRKH advocate, founded MRKH Malaysia in 2014. The MRKH Malaysia community focuses on empowering and ensuring women facing this syndrome are heard and are not alone in this journey. As only 1 in 4,000 to 1 in 5,000 cases of MRKH are reported, it is known as a rare disease and is listed in the Malaysian Rare Disorder Society.
The MRKH Malaysia provides a community where young girls facing this syndrome are understood and they have people to relate to about their hardships, as to lessen the chances of these MRKH patients developing depression and anxiety.